Hello, a very good morning. I am Dr. Devangsha from the Other Song Clinic, and today I am going to share a case of motion sickness. This is a case of a girl aged 6 years, and I had consulted her on 4th of June 2024. Motion sickness is common and a complex syndrome that occurs in response to either real or perceived motion. Its presentation can be diverse and may include gastrointestinal, central nervous system, or autonomic nervous system symptoms. The main symptom of motion sickness is typically nausea. Women are more susceptible to it than men, and motion sickness begins around the age of 6 and peaks at age of 9, and there is a subsequent decline during the teenage due to habituation. Around 80% of general population is susceptible to cases of medium to high motion sickness. So what are the symptoms of this child? She vomits when she has a sports class, when she is traveling in a car or in a train, any physical exertion, or drinking too much water. At 6 months of age, she had high-grade fever and she was admitted for the same. She had vomiting, dehydration 5 months ago and admitted for the same. Vomiting was worse by movement in the car and physical exertion. Mother had severe vomiting during 7th and 8th month of pregnancy. And the cause of her vomiting was smell of food like boiled milk or sour smell. Her appetite in general is good. She prefers warm food. She likes paneer tikka. She is thirsty, hot. She has an urge for stool after eating. She sweats on her face and she sleeps on her sides. She is scared of ghost. She describes the ghost as dressed in white color, having big nails. The legs are kind of reversed, and the feeling is that they will kill her. She is scared of firecrackers, tiger, lion, dogs, and they will also kill her. Mother says that she is very caring, obedient, shy, timid, non-aggressive child. So when we repertorize her symptoms of motion sickness using the Bonning-Hussein's polarity analysis, the first remedy that comes up is cocculus. And cocculus is one of the main remedies for the symptom of motion sickness, travel sickness, or car sickness. And in what kind of a person we see this? We see this in a patient or in a girl who is very caring, very timid, mild, non-aggressive, obedient child, which typically is what cocculus is mentally. And hence she was given cocculus. And then we see what happens to her after 2 weeks. There is no episode of vomiting. History of some cough, eating outside food. After 1 month, she had one episode of vomiting, that too after a long car travel, but no vomiting in short rides, so the potency was increased to 1 m. After 1.5 months, she vomited 4 to 5 times, and this was followed by fever. But during her sports class, there was no vomit. School van also no vomit. She was given cocculus 10 m at that point of time. And after 2 months, once she had an episode of vomiting. Overall, the mother rates an improvement of 60% in 2 months. In 4 months, there is no vomiting at all. And this is how the graph of her improvement looks like after 4 months. So we kind of achieved around a 90% improvement in her vomiting. And at that point, the mother says that she would want to stop homeopathy and see. Now this was 1 year back, and still there is no episode of vomiting or relapse. And she is enjoying life without vomiting. So thank you for watching this, and I hope that you could learn something from this particular case.